standing order remains suspended for the remainder of the sitting till it ends on Wednesday.
Introduction of bills.
Senator Cummins.
Mr. President, I beg to move the first reading of the Appropriation Bill 2026.
The question is that the Appropriations Bill 2026 be read a first time. Will those honourable senators in favour, please say aye. Aye. Those against, please say no. The things the ayes have it, the bill is accordingly read a first time.
Public business.
Public business is now the order of the day.
Order number one, sir. In the name of the Honourable Leader of the Senate, to move the second reading of the Appropriation Bill 2026.
Senator the Honourable Lisa Cummins.
Thank you very much, Mr. President. At the outset, I'm going to apologize for what is going to be the inevitable loss of my voice at some point during the course of the next few minutes, but I will do my best to get through the presentation of this appropriations bill. Mr. President, I too want to join you in expressing our condolences to the members of the dining room. All of us have, over the last several years, engaged with Andy. Some of us called him dads, and we're used to sitting at the bar or engaging with him as we pass through on our way to the lunch table. And I know that for him, his daughter Gloria, and his family, this has been a difficult time, and we want to also join you in extending our condolences to his family. We spent a lot of time in this place, and as a consequence, we built relationships with the people who work here, who are very much like family to many of us. And so we join his family in expressing condolences to all those who've been touched by his passing. Before I also get into the actual presentation of the appropriations bill, I also want to do something that I did not do on the last occasion we met when we did the constitutional amendment, and it was to acknowledge the contribution of those independent senators who served over the last term of Parliament. We have back with us our own Rev. John Rogers, Senator the Honourable John Rogers, and we're happy to have him. And of course, Senator Malalu will return, but there are others who served with us over the last term that. But I was on count to him. And the president has reminded me that Senator Connell was not long, but he was the last term, and I was going to come to him because he joined us late in the last term and he's returned, and we acknowledge his return. But certainly persons like Senator Christopher Maynard, Senator Lindell Nurse, we want to acknowledge their contribution and the relationship that they built. I get the honor of obviously continuing to work now with Senator Christopher Maynard in a different environment, but I am happy to have had the opportunity to have met and served with them here in this Honourable, the Senate, and I want to thank them on behalf of the government side, and I would risk to bet on behalf of the Senate overall for their contribution to the Senate over the last parliamentary term. Thank you very much to all of you. Now, Mr. President, this appropriations bill was presented in the other place a few weeks ago, and we had, subsequent to the presentation of the appropriations bill, we had a number of ministries presenting in the well of Parliament. And by that, for those persons who were not following or were not familiar, the well where we had specific ministries of government presenting on their estimates of expenditure, how it fit into government's overall program, what had been done, what was in train, and what was underway. Because, Mr. President, government and governance is in fact about coherence. It is about coherence in policy making and speaking to the relationship between the appropriations bills as presented by the individual ministries, the allocations that have been assigned for the upcoming year, the forward year, the second year, and then the third year even, Mr. President, but also looking back at what had been spent in the year before. That is the nature of the continuum of government. And so we see how government's expenditure has taken place, if you want to call it, Mr. President, like you have a hire purchase account, or you have a mortgage, or you have a car payment, and you amortize it over multiple years. The government has a given objective. That objective is the ultimate long-term plan, and we have amortized the financing of that long-term plan over multiple years. That's what the appropriations bill represents. And so in each year, each financial year, we look at these big books that I see around the table and at the back of the room, that ministry by ministry by ministry will assign the estimates that have been allocated to that ministry. It will have heads of expenditure, specific budget lines assigned, and it will tell you what is meant to be done. What is not there, Mr. President, would be the specific activities which are being undertaken under those heads. Those things historically would come in the government's program budget, and you'll see them in the program budget that will break down the specifics every year. Now, in more recent years, over the last few years, we have the commitment for results framework, which is outcomes oriented. So it takes the original appropriations bill, the original government program budget, and it assigns results. Those results would include the missions framework. So there is coherence. It's not in a single place. It is laid out over multiple documents, over multiple years, but there's absolutely the coherence of government policy. The budgetary statement, however, which then comes at the end, then has a very specific role to play in terms of what is being proposed there. But if you take one thing on its own, without policy coherence across multiple documents, then you're always going to be missing the mark. And so, Mr. President, I want today in my presentation to treat to the appropriations bill by looking at those things. Now, these estimates in the appropriations bill cover the financial year 2026 to 2027. That financial year will begin on April 1. Equally, Mr. President, over the course of the financial year, and I'm taking time deliberately to go over this because I know that we have a number of new senators here in the Honourable Chamber, and we also have a number of people who don't necessarily, if you don't work in government, if you don't anchor in government, if you never anchored your work in government, it sounds like some foreign language. So I'm deliberately taking the time because we hear a lot of commentary from time to time about what is not there, what was not spoken about, what is missing. And I'm simply taking the time to make sure that people understand where these various things come from. Now, we equally have during the course of the financial year, the estimates of expenditure, yes. Now, Prime Minister, certainly in the how many of years that I've been in cabinet, Prime Minister's posture has always been not to come for supplementary resources during the first 6 months of the financial year. And that really is because it is an indication from her that if you need to have supplementary resources during the course of the financial year, you haven't planned. You haven't planned properly. And by planning, I've already talked about the program budget for the government. I've already talked about the missions framework. I've already talked about the commitment for results framework. But what I haven't yet talked about is the fact that every ministry is required now, by law, under the Procurement Act, to have a procurement plan. And so the procurement plan correlates to all of those things, and it tells you what you are meant to be procuring during the course of the financial year. So there are multiple documents that all go together for government's planning. By 6 months in, you've been able to figure out what the government is executing on, certainly in my own ministries, and I know that for some of the others, on a quarterly basis. We're going to sit with our ministry. We're going to sit with our officials, we're going to sit with our financial controllers, and we're going to say, here's the program budget, here's the missions framework, these are the things that are programmed for the course of the financial year, what have we spent? And we can tell you within quarter one that we are executing on 10, 15, 20, 30% of your expenditure expectations. We can tell you that by quarter two, you're halfway through. We can tell you that by quarter three, you're falling behind, you've only hit 55%, and you're going to have to expedite your rollout and your execution of your projects. And then somewhere by the time quarter 3 rolls through to the end, and you start quarter 4, some of us say to our officials, that money, if it's not spent, is going to get, in Barbadian parlance, huffed. Prime Minister is going to huff that money. The Ministry of Finance is going to huff that money. And what are they going to do with those monies? They're going to see this ministry does not have the ability to execute on its full expenditure plan in the course of the financial year. Those monies then have to be reallocated elsewhere in the system in areas that do need money, where there is a shortfall, where they're executing faster than another ministry, and there's the ability for a greater rollout. And especially where you have big ministries with big public service expectations like education, where there's always a need for CapEx work there, where there's always a need for refurbishments of schools, like the Ministry of Health, where you have to deliver health care for people. There's always going to be the reallocation, like the Ministry of Transport and Works and like those social sector ministries. Those are typically the areas where government will reallocate financial resources from areas that are not spending fast enough before the end of the financial year. And so come next week, you are going to see the other place meet, and they will have supplementary resources, and that will be their assessment from the Fiscal Risk Unit of the exceptionally skilled professionals in the Ministry of Finance who are going to say, here is what is currently in the allocations for these ministries. These are the monies that are unspent. In addition to that, Mr. President, you will have another source of revenue. You will have a revenue call that will come in from VAT take, and it will come in from the corporation tax take. And so those are revenues that are coming in addition to unspent monies. And so that's where you're going to see reallocation of funds. So those are some of the things, not even all of the things, but some of the main things that I wanted to put into context. So anybody who says that there is not coherence because of one part of it does not understand governance and government and how it works and how government financing, government programming works. So those are some of the elements. And I'll come to some of the sources of government financing in a minute. Over the last year or so, last few weeks, as we talked about the estimates has around $459 million of planned expenditure coming from foreign sources. What are these foreign sources of financing? The Inter-American Development Bank, I'll talk a little bit more about what that is during the course of today. The World Bank, same thing there. The European Investment Bank, we'll talk about that. The Development Bank of Latin America and the Caribbean, CAF, we've heard quite a bit about that. And then there's the Exim Bank of China. Totally, overall, we have approximately $459 million in foreign financing and approximately $228 million in domestic financing. So you start to accumulate that and you get a sense of the source of financing. This is just financing. This has nothing to do with the additional take from government revenues, whether it be VAT, corporation tax, and so on. I'm deliberately taking the time to go through this. In total, the debt service relating to those foreign and domestic sources of financing, you have approximately $1.5 billion covering both interest payments and the amortization rates. But all of those things having been said, let me go back to some of the discussions that we have had over the last couple of years. Mr. President, when I first joined this Senate, I joined the Senate as the chairman then of the Bridgetown Port. At the time, that was what, 2018, September 2018? Within 2 years, we had COVID. The world changed then. By change, I meant that shipping lines became disruptive, supply chains became disrupted, access to goods became disrupted, access to services in some cases became disrupted, and the world became a very different place. Now, Mr. President, fast forward to 2026. And if you thought the world was a very different place in 2018, my God have mercy, 2026, it is an entirely different place. And so at each phase, you have seen government's appropriations bills and government's expenditure correlate to where Barbados is in the world at a given time. We saw in 2018 a government responding to a fiscal crisis and attempting to do a debt restructuring and to manage the fiscal crisis of the country at 2018. By 2020, we saw the government dealing with COVID as a crisis. And you saw the government then by 2021 dealing with COVID as a crisis in 2022, then dealing with unplanned expenditure related to our resilience agenda and the climate crisis, and you saw the natural disaster issues. So government had to respond to those things and the attendant social policy requirements that came about as a consequence. So government's expenditure changed. And it changed as you saw revenue evolved. If you remember, Mr. President, when we had COVID and the bottom dropped out of one of our sectors, you saw a decline in revenue in the millions of dollars in a relatively short space of time, and that gap had to be filled from somewhere. So government's financial planning changed then. So here we are now in 2026 with the world in crisis, war, rumors of war, and the news this morning in the New York Times talked about the bombardment of Tehran, and I'm sure that the Minister of Foreign Affairs is following these things even more closely than many for obvious reasons. But what do these things in abstract places, remote places, far away from here have to do with us? Everything, Mr. President, everything. They have everything to do with us. We import oil. We import pretty much everything that we consume. We are a price taker, not a price setter. In economics terms, that's what they will tell you. We are not determining the prices of anything. And what that has meant as a price-taking economy like Barbados, that cost of living has then become a key issue for Barbados. And so, Mr. President, I want, first of all, to look at the allocation of expenditure for different ministries, but I want to start by focusing attention. And over the course of the next 2 days, 3 days, we'll hear from different persons speaking on different subjects. So I am not going to get into all of the ministries, but I've given you the global overview. But I am going to take just 2 minutes to perhaps show how the cost of living issues driven by energy crises and the impact, therefore, on everything that has a throughput in the productive sectors has then evolved. Mr. President, in 2022, 2023, the ministry that I had the privilege of leading then was the Ministry of Energy and Business. The allocation and the estimates of expenditure at the time was $68 million. By 2023, 2024, the allocation and the estimates of expenditure was $74 million. 2024 to 2025, the allocation was $82 million. 2025 to 2026, the allocation was $86 million. This year, Mr. President, the allocation is $87 million. And so there has been an incremental increase in the allocation to energy. And that's driven largely by us subsidizing and taking putting greater absorption measures in place for all of the external challenges that we are facing. What that has meant, Mr. President, is that the government has been able to put a number of measures in place, and I'm actually not going to spend any real time on energy and business today for a reason which I will share in a minute. The Ministry of Energy and Business has been spoken about extensively in the other place and in the public spaces by the minister who has now taken over that portfolio. And I'm happy that he has, as people would call it, a foundation to run on, a platform to jump on, and that the ministry is in a good place, a good state that has allowed him to run forward without any hesitation. And so here we are now with a different ministry that I want to spend most of my time on, Mr. President, and I want to take a moment, having gone through the overall estimates of expenditure, where the source of funds comes from, and why this is important at this point, Mr. President. I want to make, however, 3 points. The government's financing has responded to both the external and the domestic circumstances facing the government. External circumstances by way, Mr. President, of engagements with partners like the Inter-American Development Bank, but also like new relationships with CAF, with the Saudi Development Fund, Mr. President. Those are all newer relationships driven by the exigencies of international circumstances, but domestic circumstances as well. What do people want? What are people looking for? What are people calling for? And those are some of the things that you have seen. Mr. President, we talked about Barbados in historical terms, punching above its weight. We can see Barbados punching above its weight in so many ways. Prime Minister has become the global voice of climate. She has become the global voice of the Bridgetown Initiative. We have the entire international financial architecture being fashioned after something called the Bridgetown Initiative. If that's not punching above our weight, I am not sure what is, Mr. President. We had the Prime Minister over 6 years serving as the chair of antimicrobial resistance. I'll talk about that in a little bit, under the World Health Organization. Even in the World Health Organization, we've seen some changes over the last little while, countries withdrawing from the international architecture and the rules-based system to which we're all accustomed. Barbados is functioning, Mr. President, in a space that is unprecedented. It does not allow this government, who anchored through 2018, who anchored through 2020, who anchored through 2022, now in 2026, to play only to partisan considerations or things that are parochial but are not comprehensive. This is a government that has steered us through the most difficult of times. And so, Mr. President, the intention is that while Barbados may be small, while in geography we may be a small state, we are proving that small countries like ours can lead big conversations on the global stage. That has been this government's legacy so far, Mr. President. So now, I want to get into the specifics of the ministry that I now have the privilege of leading, because I want to get right into that on purpose. Over the course of the time of the discussion, there are other things that will come up, I'm sure, and I will speak to them as they come up. But this is my first engagement on matters as Minister of Health, and I wanted to use my time having painted the broad macroeconomic framework to speak about this, Mr. President. Now, Ministry of Health and Wellness, the allocation for this year is $485.7 million, $485.7 million. Mr. President, in 2022, the allocation for the Ministry of Health was $410 million. 2023, allocation for the Ministry of Health was $430 million. In 2024 to 2025, the allocation was $455 million. In 2025 to 2026, it was $470 million. And this year it is up to $485.7 million, Mr. President. That has nothing to do with any move-ins that you have seen. And when I call move-ins, I talked about the supplementary allocation of governments over the course of the year. You did hear in the other place last week the additional allocation to the Ministry of Health coming from the Minister of Finance. What the Prime Minister did not get a chance to tell everyone she has done, and to make me struggle a little bit more to carry the weight of the existing Ministry of Health, is that she has also transferred sanitation back into the Ministry of Health, and so the Ministry of Health and Wellness is also carrying the sanitation portfolio. And so as a consequence, we are carrying the Sanitation Services Authority. You will hear more about that during the course of this week, probably on Wednesday. You have the Sanitation Services Authority, the landfills, of course, waste disposal, and general garbage collection, waste and sewage. So that has now been transferred back under the Ministry of Health. And so together with my Minister of State, Minister Davison Ishmael from the other place, we will carry these two portfolios. So, Mr. President, we have clearly, demonstrably, by the numbers I have just given, increased our allocation to healthcare. I have not spoken about SSA as yet. That will come later. But under healthcare, that's what I've spoken about. And I want to go directly to the concerns that the public has raised on healthcare. Waiting times at the Queen Elizabeth Hospital, without a doubt, number one public policy consideration. Waiting times at polyclinics, without a doubt, definitely an issue. Access to specialist care and access to surgical facilities. Those are the things that typically, from a scan of public sentiment, are causing people to groan like someone to my left just did. So, yes, I know, right? So, Mr. President, here's what I want to do over the next few minutes. I want to share what I have experienced and what I have found. Over the last few weeks, I've taken the time, as I said I would, to listen. And by listening, what have I been doing? I've had the opportunity to visit every single polyclinic in this country and to meet with every single member of staff present in those polyclinics. I've had the opportunity to visit the district hospitals and to meet with the staff there and even see the patients in those locations, Mr. President. I've been in the Queen Elizabeth Hospital. I've spent the time over the last week every day inside the Queen Elizabeth Hospital, not in my office. Not just meeting the doctors and the nurses, but meeting the orderlies, meeting the cooks, meeting the people who work in the laundry, meeting the people who work in the labs, meeting the pharmacists, meeting the people who are part of the cogs of the wheel that keep the system moving. Everybody goes together. And so, Mr. President, what I have found over the last 4 weeks of assessing this behemoth of a ministry that the public is pretty concerned about whether it works or it doesn't work, is that there are some things that really work really, really well. There are some things that work well. But you know, we as a Barbadian people, at the end of the day, health is one of those things where it's personal, right? It's personal. It's one of those things where I've told the staff as we've met, people don't meet you by choice. It's not like tourism, where people have chosen to come to the country and so they're arguing for what they paid for. It's not like energy, which oftentimes is an investment opportunity and people have chosen. It's not like business, which people are investing in and so on. But it's personal. You've typically met people on the worst day of their lives. You've met people when they're at their most vulnerable. You've met people when they're sick or their loved one is sick. And so what happens there is more deeply felt than anything else. It may be reasonable. Sometimes it's not unreasonable, but it's all expected and understandable because it's so personal to people, right? So here's what we have found so far. These estimates of expenditure include a ton of things that are meant to strengthen the healthcare system. What do we have in these estimates so far? Healthcare system strengthening. We have the investments coming by way of the expansion of the Queen Elizabeth Hospital over onto the new Enmore site. Over $387 million is earmarked for that in principle. That allows, Mr. President, and that's loan financing. That's meant to deal with procurement and equipment upgrades at the Queen Elizabeth Hospital. Then there is a separate body of financing, also accounted for in these estimates, that is designed to go towards polyclinic refurbishment. When last, the David Thompson Polyclinic in St. John, which I've seen, was the last and the newest of the polyclinics. That was 2016. It was finished and delivered in 2019. But before then, Mr. President, when last have we seen a new polyclinic? Every polyclinic in this country, Mr. President, 7 of them will be completely refurbished and upgraded, and 2 of them will be completely rebuilt. That is programmed in these estimates and is meant to take place in this financial year, to begin in this financial year. So what have we started to do, Mr. President? We started the process. Each polyclinic has outlined what it is they're proposing to do. They've outlined what they're expecting to have a full state-of-the-art 21st century forward-looking polyclinic to look like. But I'll come back to that in a minute because there is a deficiency, Mr. President. I'll come back to that in a minute. The Queen Elizabeth Hospital has done the same thing. The Queen Elizabeth Hospital is meant to expand across the way onto the Enmore site. And that Enmore site is meant to be connected by a bridge to the main facility, and then the main campus is also meant to have some refurbishments. That is also meant to begin during the course of this financial year, Mr. President. We've seen the new geriatric hospital on the outside. It looks ready to go. Someone asked me the other day if there are lights, because they don't travel at night. They said there are lights on a new geriatric hospital. I said it looks like you can land a plane It looks so much like a runway when you pass there, but they are fitting out the inside of that new geriatric hospital, and we're going to see that opening during the course of this financial year as well. Now, again, the way the estimates runs, the financing for the new geriatric hospital began in financial year 2025 to 2026. You're going to see it closing off in financial year 2026 to 2027. Government is about coherence and it's about continuum. So that's what you're going to see, Mr. President. But you know what I found over the last couple of weeks as I've gotten into the weeds of my listening tour, as my staff has called it? We have allocated increasing amounts of finances in every financial year. We're now at 22% of total expenditure this financial year in primary health care, namely in the polyclinics. 22% of our allocations have gone. Last year it was 17%, and we're spending more money in our polyclinic system. But Mr. President, here's what we're finding in Barbados at the same time, and I know that Dr. Connell would be in a position to say this perhaps longer and more often than me. What we are seeing, Mr. President, is that the wait times at the Queen Elizabeth Hospital and the issues at the Queen Elizabeth Hospital in A&E is directly correlated to the systems between the polyclinics and the Queen Elizabeth Hospital. People are presenting sicker because people are going to the doctors later. They're not going to get their primary health care. They're not going to get their checks. They're not managing their non-communicable diseases as they should. And then by the time they show up at the Queen Elizabeth Hospital, they're sicker. And so they spend longer times internal to the QEH hospital in tertiary care, which means that discharge times are extended. And what that means is that the throughput then from A&E is compromised. It also means, Mr. President, that 24%, this is the other part of what we have found, 24%, and the health sector report of 2023 also shows quite a bit of this, and you'll see it correlated throughout the estimates over the last 2-3 years. 24% of the cases that do present at the A&E should not be there. 24% of the persons who present in A&E do not need, they're neither an accident, neither are there an emergency. And so what ends up happening a lot of times is that in the absence of going to another facility, either a polyclinic if it's a 24-hour facility, or a private individual doctor, or waiting until the morning and going to the hospital, people go to the QEH, 24% of them. And they spend extremely long wait times because persons who are genuine emergencies or genuine accidents are always going to be triaged and handled first, and it results in longer waiting times. So how do we manage that? How do we make sure that people feel that the standard of care is such that they do not need to all descend on the Queen Elizabeth Hospital? Not to mention, when things happen like a mass casualty or a shooting or something like that, and people then have to find their way into the A&E, either by ambulance or by private vehicle, and the A&E has to be shut down, and you divert resources away from dealing with other persons to deal with those instances. So, Mr. President, we have some real challenges that we have to navigate on terms of system. So a modern health system is what we're working through now, but that system doesn't begin with a hospital alone. It doesn't begin with new polyclinics alone. It begins with a complete re-engineering, business process re-engineering of the patient flow of a hospital. And therefore, Mr. President, the ministry's remit in this financial year is to effect health system transformation, not health sector, health system transformation, looking at all of the constituent parts of the health system. And by the health system, I'm talking about what is in your community, what is in your polyclinic, what services can you get in your polyclinic, and when can you get them, and for what purposes? How do we keep people well in their homes and in their communities and using the polyclinic system without getting to tertiary care? How do we improve on our secondary healthcare system so that fewer people find their way into the tertiary healthcare system? But here's what is also true. How do we make sure that when persons leave the Queen Elizabeth Hospital, post-acute care, that they also have the ability to have step-down care, rehabilitative care, post-acute care, so that sometimes, Mr. President, we have two things happening. Last week, we had to make an appeal to the public. Come and get your relatives. Come and get your relatives. There are people who have decided that they don't want their relatives and they're leaving them in the Queen Elizabeth Hospital. That happens every single day. There are those, we have around 40 persons in the Queen Elizabeth Hospital who have largely been abandoned. And their relatives, when the social workers tell me, they call their relatives, I ain't coming for he, I ain't coming for she. I actually personally feel, Mr. President, that when persons take those positions, that the state has to step in and make a decision, okay, if I am looking after this person, then you shouldn't be cashing the pension check, no? Right? There has to be some kind of responsibility there. So there are those extreme cases, but there are other genuine cases at the same time. And by genuine cases, what do I mean? I mean, Mr. President, there are persons who, in the absence of hospice care, rehabilitative care, or post-acute care, do not have anyone with the ability to care for them in their homes, and their relatives, out of love for them, not abandonment, know that they can't be cared for in their homes, and they're better off internal to the Queen Elizabeth Hospital. And so they stay there until such time as they're fully recovered and can go home. That is why, Mr. President, in these estimates this year, you see an allocation for, and you saw it also in the Barbados Labour Party manifesto, and we're delivering on that, for a rehabilitation facility and hospice care, which would allow for monies to be allocated to taking care of persons after they leave the hospital. So how do we strengthen persons going into the polyclinic system, in your communities, and then in the Queen Elizabeth system? So these are some of the things that we are navigating, Mr. President. So here is what, I missed something. Here is what we are proposing to do during the course of this financial year as we develop the plans, Mr. President. The 2023 health sector report tells us that we have 9 polyclinics and 2 outpatient clinics delivering primary care, while acute, secondary, tertiary, and emergency care we know are largely delivered through the QEH. But it recommends, Mr. President, and that is proposed in these estimates of expenditure, for extended hours to be resumed at the Maurice Bayer Polyclinic and the Randall Phillips Polyclinic. These are meant to come back in place, having been suspended in 2020. And we also know that the Sir Winston Scott Polyclinic is also meant to be a 24-hour facility. And what we've seen is that they're handling 49% of the cases that are then subsequently going over to the Queen Elizabeth Hospital. I already spoke earlier about the challenges that we're seeing with persons coming into the system. Mr. President, these estimates of expenditure also cover a number of other areas. We've seen, and I mentioned earlier, the country being positioned to be where it is. We also have seen an allocation being increased for non-communicable diseases, and for there to be expenditure relating to things like how to manage non-communicable diseases in your community, but also how to invest in things like the teaching of healthy lifestyles, a nutrition unit. All of those things are seeing increases in expenditure, Mr. President, in these estimates of expenditure. One of the things that I'm proposing to do during the course of this year, Mr. President, is to be able to build a transformation committee. A transformation committee that looks at the system as it is overall, not the sector, but the system. How do we design patient flow, Senator Connell? How do we have a system that allows for us to be able to identify who should and should not be where, who needs what and from whom, and at what level? How do we integrate with the public sector and with the private sector? How do we then work with the urgent care and the FMHs and the Sandy Crest of the world to be able to deliver services on an as-needed basis? How do we have additional capacity? Mr. President, we've also met with the Barbados Community College and with the nurses about the importance of investment by way of the Ministry of Technical and Vocational Education, MTEE, and they have in their estimates of expenditure, you will see them in this appropriations bill, Mr. President, the expansion of, and you've heard the minister for this ministry speaking about the creation of the University College of Barbados. And in that, you're meant to have a number of specific schools that are meant to be launched. In those schools, Mr. President, you then will have a school for nursing. And that is meant to increase the capacity for us to pull out more nursing, teach more nurses to go into the system. But there is more, Mr. President. These estimates of expenditure in accounting for there being a University College of Education, University College of Barbados under the Ministry of Education, MTTE, not educational transformation, accounts not just for nurses, but for pharmacies. And one of the things that we are going to be doing under these estimates of expenditure, Mr. President, is building out something that I did in the Ministry of Energy, the future of work in healthcare. What are the skills that we need to build over the next year, the next 2 years, the next 3 years, to be able to correlate to the shortages we're experiencing now on the one hand, but also to develop new disciplines and new specializations that position Barbados to be able to provide the kind of care that we have not been able to provide so far, Mr. President. So those are some of the things that we're meant to do as well. We are also, Mr. President, in these estimates allowing for the allocation of extended hours in the polyclinics that I mentioned and to divert non-urgent A&E demand. We also, Mr. President, are seeing in these estimates of expenditure, significant expenditure on the diagnostics component of the healthcare sector. What do I mean? This financial year, with the combination of our own budget and from philanthropy, we have seen a linear accelerator come into Barbados. Now, let me just address that very quickly. We never had a linear accelerator, Mr. President. We have one now for the first time. But I remember when we had a drive-through scanner in the Bridgetown port. The scanner was one thing that we had to install in 2018, 2019. But the civil works required to install that kind of equipment is not a regular wall. It's not a regular build, and so it takes time. And so a linear accelerator then needed to have the civil works executed also under the QEH to be able to facilitate that the width of the walls necessary. I remember, Mr. President, we had the Environmental Protection Department coming in. I remember us having the offers of assistance, and they subsequently provided the assistance from the International Atomic Energy Agency to come and to look and review and to make sure that the radioactive rays were negligible and were not likely to affect the people who were working in those areas. A linear accelerator in Barbados is meant to do the same thing. We never, for the record, had a CT scan in the emergency room of A&E, Mr. President. We have one now. I've seen it with my own 2 eyes. It is there now. You used to have to take a patient upstairs to another department, up to radiology to be, now you have a CT scan in the A&E department, Mr. President. Those are investments from the last financial year. This financial year, Mr. President, the expectation is that you will have diagnostics equipment, not just in the A&E, which was done this last year, but to have diagnostics equipment in 3 polyclinics potentially across the country, because that also helps to take some of the pressure off of the emergency room and to make these polyclinics fit for purpose. And equally, I have seen with my own 2 eyes in the current infrastructure how walls were constructed originally in at least 2, maybe 3 locations for X-ray equipment that wasn't there. But that is meant to be in the new facilities that will be there. Those are programmed in the estimates of expenditure, Mr. President. Now, drugs, medicines. That's a big deal. I hope that the chair of the Drug Formulary Committee, whenever he speaks to the public, that he speaks about the challenges that we have been having with drugs. In this estimates of expenditure, Mr. President, you will see some new areas that have not been there before. The Barbados Pharmaceutical, Inc. Barbados Pharmaceutical, Inc. is an entity, Mr. President, and I want to acknowledge Senator, the Most Honourable Jerome Walcott, for having piloted these initiatives through the Ministry of Health over the last several years. The partnerships with the governments of Rwanda and globally to allow for Barbados to have a pharmaceutical industry in the first instance, one, to be able to have a regulatory regime that did not exist for the first time, to be able to get us to tier 3, ultimately over the next few years. And they have been working on getting the new regulations, and I expect that in due course, I will have the honor of bringing that legislation here, Mr. President, for the Parliament, this place and the other places to debate. But we have, in these estimates, increased allocations for the Barbados Drug Service to be able to make sure we can account for the things like our stockouts, Mr. President, but also to find new suppliers. Those are some of the things that we are navigating. Now, I've heard from many of the advocacy groups about the importance of NCD outcomes. These estimates, and I know that many people were looking for statements to be made in the budgetary statement, for example. But I remember, as I said to one of them, because you don't hear it in the estimates, doesn't mean in the budget, doesn't mean it's not in the estimates, doesn't mean it's not in the program budget, doesn't mean it's not a continuing program that you have seen over the last number of years that there may be an allocation for. And so equally, there is money allocated in the estimates of expenditure for NCD's outcomes improvement and to be able to have investment in the areas that are concerned. And so, Mr. President, you have under the UNOPS agreement that has been signed by the ministry in collaboration with the Queen Elizabeth Hospital, a budget of approximately $16.5 million US dollars allocated from a European Investment Bank, I spoke about them earlier, loan, and that is scheduled to be completed by November of this year. That is going to deliver, Mr. President, a health information system. And that is meant to make sure that there's a correlation between when you take your patient notes from one part of the QEH to the next. What you will see in this financial year, Mr. President, is the expansion of that 2025-2026 programming into 2026-2027 program that creates interoperability between the Queen Elizabeth Hospital and the polyclinic system of Barbados. So you're going to say, if I have gone to the polyclinics, Mr. President, and I have seen my doctor, and I've had blood work, the information belongs to me, yes. But I want equally to be able to take that information if I have to be admitted to the Queen Elizabeth Hospital. I don't want to be walking about with notes in my hand anymore in 2026. That's an anachronistic process. And so now we're moving away from that to make sure that the patient not only owns their information, but can take their information to whichever doctor is seeing them, whether in the public system or even in the private system, whether it is your scans, whether it is your diagnostic information, whether it is your record of medications that you have been taking, all of that will now be captured in the health information system, and your appointments are also meant to be captured in the health information system. So these are some of the areas, Mr. President, that you are seeing in these estimates of expenditure. So I want now to move on to the broader financial implications. And I'm deliberately managing, because I know I'm going to lose my voice, so I'm deliberately managing what I say at this point, because here we go. Now, starting to manage my voice. Now, Mr. President, here is the sanitation allocation. We also have under the Ministry of Health and Wellness, the sanitation allocation, and we have the, as I mentioned here, the waste management, vector control, environmental sanitation, and disease prevention. If we don't have our sanitation managed at the community level and at the household level, what ends up happening, Mr. President, is that you have health outcomes in the health sector. And so there is a significant investment that you're going to see in the sanitation services sector, and I'm looking forward to hearing that full presentation when it comes during the course of the Senate. The chairman of the Sanitation Services Authority sits in this chamber, and they will deliver a far more comprehensive presentation on the Sanitation Services Authority. But suffice to say, Mr. President, that there is an allocation in the estimates for the Sanitation Services Authority for waste management overall. And interestingly, over the course of this financial year, there is meant to be a partnership with the Sanitation Services Authority and the mangrove landfill at Vaucluse to be able to transition that facility into a green energy park that allows for us to use energy to convert the waste that has a higher calorific value, to be able to create energy, and in so doing, it reduces the cost of the management of that particular facility, but it also allows for the government to manage the annual transfer to the SBRC for the management of certain types of waste, that is accounted for in these estimates of expenditure, Mr. President. Now, these estimates, as I have outlined, Mr. President, they account for the global uncertainty that I've talked about. And I want to take just a moment to speak about global uncertainty and how we have programmed in these estimates. In previous estimates, you would have seen the Inter-American Development Bank. You would have seen the World Bank. They are still there. Over the course of last week, for an entire week, we brought, for the first time in history, and it was interesting to sit in a room and hear them talking about it, 4 development partners working together on one single intervention. For a week, last week, we had the World Bank, the Inter-American Development Bank, CAF, and the Caribbean Development Bank together working on a debt for health swap. A debt for health swap. Now, those of us who have been in the chamber and those who have been watching the news over the last several years, you have seen the government talking about a debt for climate swap. And we've done that before. We've bought down more expensive debt, replaced it with less expensive debt, and used the savings to reinvest in the sector. That's what is happening in this financial year. And so in this financial year, and we hope to be in a position to deliver it by the end of October 2026, which would fall during the course of this financial year, for a total of an additional $500 million in health sector expenditure, Mr. President. That is meant, in addition to what you've seen programmed here, but it's still being developed to then fall into financial year 2026, 2027, financial year 2026 to 2027, 2028, and then financial year 2028, 2029, and onwards. What are those monies meant to do? $500 million, $150 million approximately from each of the 4 development partners. What are those funds meant to do, Mr. President? Those funds are meant to go back into financing very specific things. When the Prime Minister started framing this out along with my predecessor, Senator Walcott, Prime Minister gave them a couple of charges. You need to work with us to identify how we make changes. How does Barbados eat? What is our culture of doing a number of things? 4 main things, keeping it very simple so that the monies are not being allocated to buildings and structures and infrastructure. Not at all. It is meant to tie health to our culture, how we live, how we operate on a day-to-day basis, and how do we make interventions in those areas. And so that will be an additional allocation into the Ministry of Health that you will see and will anticipate to be programmed during the upcoming financial year into the next financial year. So coherence, connection, comprehensive, and very much, Mr. President, accounting for the uncertainty of the global climate that we are operating in. Equally, Mr. President, I believe the last day that we met, you heard me, I think I may have made mention subsequently in the media, I slipped out to the chamber and went and signed an agreement with the government of India, an India Pharmacopoeia agreement. That also was work that was started by my predecessor. The beauty of government being a continuum is that in 4 weeks, very little of what I have done is about me. A lot of it is about work that has already been started and has been in train, and so government is continuing. And so, Mr. President, the Pharmacopoeia agreement is one that has been signed, was negotiated over several months by my predecessor. And so it is about making sure that there is a collaboration between the government of Barbados and the government of India. Again, new partners, where did the government of India's collaboration come from? Many of us remember during the course of COVID, who was the first country that came and gave COVID vaccines to Barbados? It was India, Mr. President. You remember President Modi, because of his collaboration with Barbados, was able to get a special award, and the Prime Minister recognized him in one of our independence anniversary award ceremonies. And so India has now been collaborating with Barbados to be able to deliver pharmacy solutions, but using a regulatory management system that is globally recognized. And when I say globally recognized, I'm usually talking about the World Health Organization. So that is something that is there now, that is meant to help us with our management of the drug service and having access to drugs from a range of partners and being able to have drugs at a price that Barbadians can manage, but at standards that are acceptable to us, and the regulations I spoke about earlier. So we have 4 development partners in a debt for health swap. You have the Indian government working with us. But equally, Mr. President, we have new countries that are working with us on providing professionals to come and work in Barbados. We've seen the Ghanaian professionals who have come here. Now, today, we're working with Ethiopia. We're working with Ghana still. We're working with India still. And so, Mr. President, Barbados, even in our allocation of finances to program activities, is working with new partners to be able to deliver new solutions on behalf of Barbadians. So these are some of the elements that we have been navigating, Mr. President, that I wanted to raise today. And so as I wrap up this first part of my presentation, I want to come to the second part of my presentation, and I don't intend to use my full allocation today, otherwise I won't be able to talk at all for the rest of the time. But here's where I want to come now, Mr. President. Cost of living, cost of living, cost of living. It has been a continuous bugbear for Barbadians. It is what Barbadians have talked about most over the last little while. I think we've made it clear, the public has made it clear, even the economists have made it clear, we are a price-taking economy. We are not setting prices. We can't control shipping prices when they go up by 400% or 500%. We can't control those things. But we have made a number of provisions in these estimates of expenditure to allow for that. In the Ministry of Energy and Business, what are some of the provisions that we have made to account for that? One of the provisions that we have made to account for that has been the allocation to the Barbados Trust Fund Limited. Taking the allocation assigned to persons and their eligibility from $10,000, $5,000 in the first instance, $10,000 in the second instance, and taking that up to $20,000. At the time we started to make that transition, Mr. President, we knew that it would have required an increased investment from the ministry, from the government, in order to make that happen. An additional $10 million approximately, Mr. President, was anticipated. That is accounted for in these estimates of expenditure. But there's another component to that, Mr. President. The anticipation at the time, and I know that the new minister is expected to continue having these conversations, is that we would work with our development partners in the same way we're working with them in health and in other areas, work with our development partners to make available an additional sum by way of a grant that would allow for proof of concept investment, so that you have an additional sum of money for the small businesses, micro businesses in the country, to be able to have the benefit of that grant component to go along with their loan capital to allow them to build their businesses so that people can live. You've seen and you've heard the government talking about Acidilia is one of the things that we have been very proud of, and accounted for in these estimates of expenditure for Acidilia has been the expansion of Acidilia. And in what way are we proposing the further expansion of Acidilia, Mr. President? What are the things that we are proposing to do? In addition to what we currently have, Mr. President, is meant to be the expansion of the platform and having it integrated into the Asakuda World platform, so that you're able to see the landed prices and then able to see where the transfer pricing occurs along the supply chain, so that we're able to manage costs to Barbadians. So these are some of the elements that you've seen here. You've seen an increased investment in the Smart Energy Fund. The Smart Energy Fund has also been earmarked to create that greater level of investment currently, Mr. President, for the renewable energy transition from 2026, and those monies are meant to expire. We've expanded that program to allow for us to facilitate the transition to 2035 as opposed to 2030. So you will see that amortization of the financing over time. So the projected estimates revenue is projected at $5.8 billion in total. Total expenditure is set for about $5.8 million in this financial year, and the fiscal deficit is expected to be approximately $687 million, or approximately 4% of GDP. These are the things that this allocation is looking at. So I've talked about healthcare, I've made some recommendations, I've talked about what is proposed with the correlations between one ministry and another, in my case, Ministry of Health, and in the Ministry of Education, Technical Vocational Education, and even in the social sector ministries. So these things all combined, along with tourism, along with you will hear from MIST directly during the course of today, along with culture and youth, all of the ministries you will hear from, but cumulatively, these estimates are accounting for approximately $5.8 billion in expenditure, $5.88 billion in expenditure for this year. The nominal GDP is estimated at approximately $17.6 billion, and the government's operating balance is close to equilibrium. What does that mean, Mr. President? It means that although there has been this discussion around debt, the government has continued to lower its debt to GDP ratio consistently, despite all the things that I've spoken about from 2018 till now. And so the commitment to fiscal discipline and the reason why there is this equilibrium that I have just outlined is a demonstration of this government's fiscal discipline while investing in all of the things that I have outlined that are specific to what Barbados needs and what the global society, uncertainty requires of us. So the public debt is expected now, of the total amount that I just listed, 459 of that is meant to be financed through foreign financing, and 228 million of that is meant to be financed through domestic financing. So that is what we are expecting. So, Mr. President, look, the equilibrium that I have defined, I have described, the debt to GDP ratio that I have described is important to this government. We are at 100% now, and that was a target that we had set. 100%. We were not supposed to exceed the 100% ratio. In fact, we needed to bring it down. And we will see that happening, we expect, over the course of the upcoming financial year, because fiscal discipline matters to this government, Mr. President. We know what happened to us in 2018 and what we had to get under control as a result of the challenges that we experienced in 2018. And as a consequence, Mr. President, there will never be a circumstance where we will not attempt to, one, bring down the debt to GDP ratio, and of course, insist on and maintain fiscal deficit. So I mentioned before, the debt service ratio for those amounts, both foreign and domestic, is meant to be approximately $1.5 billion, and this debt, the debt swaps that we have been investing in have further given us fiscal policy space. So our debt to GDP ratio has been consistently declining, and it now stands at 100% of GDP, which is what government had anticipated we would have, and the government is committed to reducing that ratio down to 60% over the medium term. It won't happen immediately, it won't happen in one financial year, and it can't happen when the things that we want are the things that we want. You have to be able to balance it. You want to have a new house, you want to have a new car, you want new shoes, you want a new bed, new living room suite. You want it all, so it has to be paid for, Mr. President, but it has to be paid for responsibly. And so Barbadians want us to invest in healthcare. Barbadians want us to invest in education. Barbados wants us to protect the most vulnerable with social services. You've seen those allocations in the Ministry of People Empowerment and Elder Affairs. You'll hear more about that during the course of the next 2 days. You want us to invest more in healthcare. I've shared much of what is happening in this healthcare sector. You want us to be able to invest in education transformation, Mr. President. And notwithstanding that we are in the middle of BSAT season and I will wear my Cougars gear next week, we want us to invest. Y'all knew I was coming. We want us to invest in education sector transformation and to make sure that all schools, and in fairness, I see the guys around the table looking at me sideways, but I think we have all been excited by how the schools are performing and seeing all of the schools just tearing up the track and the field. All schools, never mind St. Michael's is going to do what St. Michael's does, but all schools. So, Mr. President, we are all still vested in education sector transformation. We must be, because the Ministry of Education is the second largest, the only other ministry that has as large a budget as around $400 million in expenditure, and that is earmarked for education sector transformation. That is earmarked for schools refurbishment. That is earmarked for children being in a position where they can go to school and feel as though they are in a genuine learning environment because the schools are retrofitted. That is because, Mr. President, you are in a position where children can feel as though at 11 years old they're not being discarded, and they have the ability to have the benefit of a serious investment in the education sector. That's being seen in these estimates. So in order to be able to deliver on the expectations and the legitimate expectations of Barbadians, you had to finance it. You had to finance it from revenue that we generate from the taxes, which have been lowered over multiple years, and this year was no different. You have to be able to generate it from revenue coming from external sources like corporation tax and from exports by growth of the economy. That's where you will hear from the industrialization agenda. You will hear from that during the course of the year. And so my overview has been deliberately so, a macro level overview, because different people will speak on different specific things, including the industrialization agenda, including the expansion of the work that's been happening with life sciences and so on. You'll hear about all of those things during the course of this week, Mr. President. Those things will help to generate revenue. Those things will help to fuel growth. Those things will help to create jobs. Those things will help to create opportunities for Barbadians, not just here, but abroad, Mr. President. Those things will help Barbados to continue to punch above its weight. The investment in the Life Sciences Center, those are the things that you're going to see. The GIGA initiative, you'll hear more about those things. Those are part of the development agenda, the productive sectors and the growth. Then you have the financing component, the ability for Barbados to maintain a rating, a sovereign debt rating that makes us attractive, not just to multilateral development partners with concessional financing, but to the market by way of bonds, which have been subscribed and oversubscribed because Barbados is punching above its weight, and the attractiveness of new partners to replace some of the instances where we have not had the ability to work with others in the same way that we once did. So that is where this government is going. Mr. President, this government is committed to development. This government is committed to transformation. This government is committed to reform. This government is committed to relationship management. This government is committed to relationship building. This government is committed to delivering change. This government is committed to delivering on economic opportunities for all. It's committed to delivering on accessible health care for all. It's committed to delivering on national resilience, Mr. President. This is a nation that is facing unprecedented challenges, and we are adapting, we are innovating, and in all instances and in all sectors in these appropriations bills, Mr. President, this appropriations bill, we can see that we are investing and we are expending. And so as we move forward, Mr. President, I commend this appropriations bill to this honourable senator, and I beg to move this bill be read a second time.
Thank you very much, Senator Cummins. Senator Walters.
Good morning, Mr. President. Good morning to my fellow senators. Mr. President, I wish to begin my presentation by prefacing it with the fact that in a lot of instances, when you hear the discussion around the appropriation bill, estimates of revenue and expenditure, and then followed by the budget, a lot of details are not really stretched out. A lot of the numbers are not really looked at in terms of